very few people pay particular attention to the lower lid. And I think it's so important because as we age, our lower lid kind of merges with our cheek. And so if you're going to do surgery such as a facelift, which is a cheek neck lift, you have to pay attention to that area of the lower lid as well as the cheek. And so what I did, there are numerous ways, there are very few ways to do brow lifts, right? We have endoscopic approaches or in the hairline approaches or pretrichal approaches. One way only to do upper eyelids for the most part, a couple of ways to do facelifts. But when it came to lower lids, I found that there were like 5 or 6 variations that I was doing, which made it difficult for the nurses, difficult for my patient coordinator, and extremely hard for a patient who's coming in going, what do I do with my lower lids, right? And so one of the things that got my attention is when I looked at the last 100 consultations I did, one of the things that grabbed me the most was people said they felt tired and that they had these bags under their eyes. And so I said, well, what we need to do is have a systematic way of approaching the lower lid where it's easy to understand for the patient as well as the patient's family and staff. And I said, well, God, if it's really hard for my staff, who for the majority of them have been with me for over 15 years, how about that patient who I'm seeing and spending an hour and a half with? So it's got to be totally overwhelming for her. And then I had patients who would say, well, you did her lower lids and this is what you did. And for me, you're doing something different. Why is that? So we came up with an algorithm. And what we did is we took the complaints related to the lower eyelid. So some people said, when I smile, I have this crepiness. Or when I wake up in the morning, I have these heavy bags. Some people said, I'd noticed that my eyes slant a different way or that I have white under my eye, which is scleral show. And so we took all of these factors and then we made an algorithm. So for each condition the patient complained about, we had a different approach. And what it did is it made it, to me, it made it more organized and it made it more systematic. So we were able to capture what bothered the patient. Because a lot of times, you know, as cosmetic surgeons, we kind of get in this framework of doing it the same way. And I think that's doing a really disservice to the patient. So I think our business is sort of like a made to measure here. And even though I'm in a relatively small town, we do a nice volume. But I think it's because of that. So ours is more like made to measure. We can do something off the rack and that may fit okay, but we really want to make it just for you. And the way we do that is following the algorithm.